Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised. Well, welcome back to another episode of the Birth Squad podcast. We are super excited to share with you our guest today. It's someone I've had the privilege of working with for almost going on 3 years, right?
Time flies.
So this is Dr. Nikki Liburd. Thank you for being on the podcast. Can we just start by asking you to tell us a little bit about yourself?
All right, yeah. You said my name is Nikki. I'm an OB-GYN physician, actually specifically an OB-GYN hospitalist physician. I'm the site director for one of the programs associated with my company that's called the OB Hospitalist Group. And I've been site director at this current program for about, 5 years, going on 5 years now. Time flies. But as far as working in a similar position with the company, it's probably about 7 years. I finished residency about 12 years ago. Yeah. I practice basically obstetrical, gynecological medicine in a hospital.
Or can you tell us about your path to motherhood?
Yeah, so my path to motherhood is possibly similar to maybe many women who are physicians or professionals out there, meaning that I delayed it. Looking back, I probably would have done things differently, but here we are, and it all worked out well. My path to motherhood. So I decided really that I wanted to be a mother after residency. Like, you would think being an OB-GYN physician, that's something that is definitely something you want to get started on. But that I was so focused on my education. Also, back then when I was in residency in medical school, there was, I felt, a subtle message that, hey, do you really want to take off this time to devote to being pregnant? You're not going to have much time off, So those factors led to me basically delaying getting pregnant. It was when I was about 40 years old was when I started on that journey. It's weird. It's almost like an epiphany or just something internal said to me, probably around age 39 after being, married for a few years, like, oh, this motherly instinct kind of kicked in. But then you look around and you realize, oh, but your reproductive your reproductive stores of eggs and just living life, it just kind of caught up to you. So I started motherhood a little bit later. So because of that, me and my husband, we ended up having to go through IVF. And it took about 2 cycles. But, we were fortunate, and we have a soon-to-be 7-year-old boy, my one and only. So I am definitely grateful, joyful to have that experience. But yeah, I started late. And so, that's something definitely I want, all women, regardless of whether you're, in the professional space or not, to kind of consider all of these, just how that can be impactful, because it does kind of change your journey. It can, definitely, if you're waiting.
Thank you so much for sharing that. And you're right, that is something we do see in multiple of the people in that we've talked to over season 1 and season 2.
Mhm.
We were hoping you could also take the moment to talk about your journey specifically with fibroids and how
Right.
that uh, impacted your health and your pregnancy journey.
Yeah, sure. So, as you guys may know, and also your audience, fibroids are common, but a lot of time you may not know that you have it unless it's an incidental finding for workup for other things, or if you're having symptoms, which is usually pain, discomfort, bleeding. So for me, it was more so a discomfort pain situation, wasn't necessarily menorrhagia or heavy bleeding. And it began to be a problem when I was in residency of all places. So, there's not enough time, unfortunately, in residency, at least back then, to really take care of yourself and your health, especially with regards to that and figuring out what to do. However, it got to the point where I reached out to one of my attendings, new attendings. He actually used to be one of my chief residents, so we have that kind of relationship. And she helped me kind of maneuver that. And actually, I did require surgical management because the location of my fibroid, even though it was not necessarily large, it was pushing against my bladder, you know so you can have some urinary urgency, just discomfort in general, and it wasn't really getting better. And then knowing that fibroids can grow, and maybe one day if I wanted to have a child, because it wasn't necessarily gung-ho at that time, that maybe this might impact that, right? So I ended up actually having surgery to remove fibroids. There were probably about three or so, and they weren't necessarily large. The main reason for having the surgery was for that one that was causing the symptoms. So I had a laparoscopic assisted myomectomy when I was in residency, and it seemed to help the problem. And like I said, about a few years later, I got pregnant. Fibroids at that time, when once I was pregnant, as far as the workup for infertility, I didn't have any visual fibroids that were there. You have the hysteroscopy. I had different workups for infertility, all in the hystersalpingogram. All of that was fine. So fortunately, the bothersome symptoms or the complications associated with fibroids did not affect my pregnancy. I'm glad, though, that I did deal with that at that time, especially knowing the location. That fibroid could have grown, it could have encompassed what we call the lower uterine segment of the uterus, potentially. And, that could have impacted the mode of delivery. It could also, the size grows, it could affect the growth of the baby, and just symptoms throughout that pregnancy. However, though, since I did have a myomectomy and what we call a multiple myomectomy, that actually did impact the mode of delivery that I had. So I had to have a scheduled cesarean section around 37 weeks. So there was that.
So it sounds like, based on your experience or where the location of the fibroid was, that surgery was kind of like the one thing you were considering. But were there other treatment options that were offered to you? And then how did you kind of navigate into that decision to finally just get surgery?
Right. Good question. This was back in 2011. So, and the options that are going to be presented to you are at the discretion of, probably location where you are, the comfort level of the physician, those types of things. So at that time, surgery was definitely a reason because of the symptoms I was having, right? It wasn't necessarily about heavy bleeding where I could consider more medical management. As far as invasive options at that time, yes, there's uterine fibroid embolization, but at that time, the data was more pointing towards, if that is something that you're considering, it might impact your future pregnancy, right? As far as with implantation. So that was something that, that I did strongly consider. There are, of course, newer technologies like radio frequency and different things like that. That wasn't something that was discussed, and I think probably the technology at the time wasn't as robust as it is now. And so surgical management was the option that I went with, and the one that was more, that was basically presented to me as a better option. Luckily, I was able to have a minimally invasive option. I actually was able to go home the same day. So that, that was helpful, which is an
And what
option
was
for many women too.
and what was your recovery like?
So my recovery was partly dependent on the fact that I'm a resident and you can't take off that much time. Gosh, maybe at the most 2 weeks. So it was fortunate that I did have a laparoscopic approach. So for women out there where, recovery time is going to be a factor for you, it doesn't necessarily mean that, you're a resident. You could have your job, it could require you maybe to not have as much time off as you would like. A minimally invasive option is definitely a way to go. So, I mean, the pain that I experienced to me was minimal. Everyone's pain tolerance is different. So I just needed basically ibuprofen and Tylenol, maybe the occasional narcotic. Like I said, it was minimally invasive. The only probably interesting thing is that even though I was discharged that same day, my physician did recommend, hey, if you want, you can kind of spend the night. I don't know, as a physician, maybe, and especially as a resident, not as an aversion to hospitals. I just want to go home and sleep in my own bed. Probably shouldn't have done that because I had what we call a lazy bladder. So I had bladder distension. It was horrible. I almost went back to the hospital. I was like, I'm gonna push, I'm gonna toughen this out. So, and those types of things are considered minor and not necessarily common. But yeah, that was probably the only potential complication that I have. Otherwise, it was not that difficult. I mean, say if I'm comparing this to the fact that I've had surgeries after that, this is very minor as far as recovery.
So you mentioned like you had the surgery and you
Mhm.
knew, okay, this means I have to have a C-section afterwards. Can you
Yes.
walk us through how this decision, like making the decision to get a myomectomy, affected your thought process and planning when it came to fertility and family planning goals?
Right. So, having a myomectomy, I think was, having a myomectomy didn't necessarily limit me, I guess I should say, as far as infertility treatments and things like that. It was more so considering the potential complications that could occur just because I had surgery on my uterus and I'm pregnant, right? You always worry about the relatively low risk of uterine rupture, whether you labor on that uterus or not. There's a reason why it's recommended to deliver earlier, right? So that was something that was definitely in the back of my head. What if, I was to go into labor early and end up having to have a vaginal delivery? That is always an option. I mean, a possibility. It's interesting for me, though. I mean, don't get me wrong. I was glad that I had the myomectomy, but I actually wanted to experience having a vaginal birth. You know, there's something, as women that you know is part of who we are. Birthing a baby, and to me, that's kind of the way I looked. I wanted to experience that of having those labor contractions, of having a baby in that fashion. So it did, you know, it was something where I was like, I had to basically tell myself what the big picture was, right? Having a healthy, happy baby, you're still giving birth, right? So, but then noting, being cognizant of the fact that if you do go down that route of having surgery on your uterus, or even sometimes some minimally invasive types of surgery, like a hysteroscopic resection. I mean, if you're disrupting that uterine wall in a significant way, you're going to be limiting kind of those options for delivery. But at the end of the day, is not necessarily that wasn't my number one reason um, or issue as far as being pregnant. It was to have a baby, and that's what I had. So, but those are some of the thoughts that I did have in my head.
So now let's talk about the moment where you realized that you were, pregnant now, and
Mhm.
this pregnancy was going to continue, especially in the
Yeah.
context of having gone through your myomectomy. What were some of the thoughts and emotions that you were experiencing during that time?
During that time, yeah. So just happiness, right? Because for instance, if I didn't have that myomectomy, this is several years later, there was a good possibility that it would be growing more so because I am pregnant, right? This increased influx of hormones, there is definitely increased risk of it growing, and knowing where the relative location was, how is this going to affect? I'm like, is it in addition to the fact that I was at advanced maternal age, as we say, and thinking about my ethnicity, the fact that and I know I'm going to be at a higher risk for hypertension in pregnancy, which I did develop mild preeclampsia. Wow, on top of this, if I have that fibroid, how is this, will I be able to work? Will I be at home, bedridden potentially? Will I make it to full term? So having that in the back of my head and knowing that at least I took some steps to kind of positively, impact my pregnancy by having a myomectomy, it was reassuring.
So, what were some of the concerns you had or the
Mhm.
anxiety? You mentioned some of them, right? You were like
Right.
taking into consideration my age, my
Yes.
ethnicity.
Yes.
What were some of the other things that were going through your mind during your pregnancy as you were leading up towards, delivery?
Right. Like wondering if I'm going to even make it to 37 weeks because I'm working full time as an OB-GYN physician. It is, there's a lot of sleepless nights. There's a lot of unscheduled work that you're doing. It's interesting. I mean, I think, yeah, I was at 32 weeks. I was working, as said before, I'm a hospice physician. So the majority of my work is done in the inpatient setting, taking care of women either that don't have regular care, don't have a physician, taking care of obstetrical or gynecological emergencies. So you're on your feet, you're doing a lot, and being pregnant, third trimester. I had beginnings of preeclampsia at that point. I was working and I was not feeling that great, but I'm the only doctor on call at that time. There was a woman in the ER that needed urgent surgery for an ectopic pregnancy. I had patients on the board who were in labor, but I didn't feel great, So I was placed in a hospital bed, did workup for preeclampsia, and still taking care of patients as I'm waiting for the next physician to come in to hopefully relieve me early. Okay. So I knew I was going to have a stressful pregnancy just from the mere fact of my job. So that was definitely something that I had to struggle with and pray about. Luckily, I got to 37 weeks and was able to have my baby. But that is definitely something to consider, Yeah, you can do your job, but there's obviously going to be things that come up that you're not in control of. And you have to be ready to face that and be okay with that. Because, I could have been told to, take a break from work for the last few weeks. Didn't happen. I mean, if it did, I would be okay with it. But you have to understand that having a high risk pregnancy on so many different levels, history of myomectomy was just one of them, that, you're not going to be in control of everything. You just have to accept that. Yeah.
And so you talked a bit about, given your history of the fibroids and your myomectomy,
Mhm.
you were planned to have a C-section at 37 weeks already. That was kind of
Right.
predetermined. Was there any extra
Mhm.
care that you received during the course of your pregnancy, extra appointments or ultrasounds or anything like that?
You know what? Not specifically for the fact that I had a myomectomy. Um, it was more so for the fact that I was advanced maternal age and I had a history of IVF, right? So, with maternal fetal medicine, which is high risk pregnancy specialist, I did have extra scans for growth. I had a fetal echo. Those types of things were done for me. Some of the visits were a bit more frequent because of those, but in just because of having a myomectomy, no. Now, say if I had actual fibroids that were large or causing these symptoms, yeah, that is definitely would lead to more visits, more monitoring, potentially even hospital stay. I mean, there's women who come in because that fibroid could be what we call degenerating, losing some of its blood supply because that blood needs to go to the pregnancy. And, the way I explained it to patients, it's almost like having a second baby. And the baby's upset because it's not getting fed. So it's going to act up. You're going to have some pain. You may have to go to the hospital for that. So those things are, considerations to consider, especially if you have any residual fibroids. Because a lot of women, they don't know necessarily that they have a fibroid until they get pregnant. That's real, and you just kind of have to move with the punches, and you might need extra care and attention. So, yeah.
Thank you for saying that. That's so true. And I love the
Mhm.
way you phrase that. And I might have to use that with some of my patients as well.
Yeah, yeah, yeah.
So, can you tell us about your birth experience? So, we know you made it to your delivery day. Can you just
Yes.
share with the audience what that experience was like for you?
Yeah, it was great. I was the first C-section of the day. I had to get up super early, which was fine. And being a physician, especially an OB/GYN physician, you kind of know what to expect, and it's almost like you know a bit too much, right? So every little thing, you basically have to tell yourself, I am the patient. I am the patient. I'm not the doctor. Just let them take care of you, you know? Just let it happen. And I did. It's an interesting feeling being on getting surgery done on you that you performed on other people. I would say that. I actually wanted to see as much as I could of my surgery. So when I had the C-section, they didn't have, some hospitals, they have what's called, gosh, I can't think of the term, but where you can actually see the baby being born. What does that call it? The drapes, and it's a clear drape.
The
Gentle something.
gentle, yeah,
Yes.
gentle
Yeah.
C-section.
So for me, they didn't have those drapes, but I had something even better. The anesthesiologist basically took as many pictures as possible, because I was like, I want to see what my uterus looks like. I want to see what the baby looks like coming out. I want to see just all of these things. So I have pictures of all of that. So that was great. Like, that's what I wanted. Now, of course, having a C-section, when we talk about skin to skin with mom and baby, sometimes it can be a little bit more complicated when you're having surgery versus if you had a vaginal birth, that baby comes to you, you're able to move around and interact with the baby. You're still having surgery once the baby is out, right? That baby goes to someone else first, and then comes to you eventually. Luckily, I was able to, look at my son and try to hold him, of course, laying on my back. My husband, he did skin to skin first, which was, I think, is a great experience for him, because he was a bit apprehensive being, first of all, in the operating room, just because of what that meant, which is common. You see that a lot with partners, but it was a great experience that he was able to experience that. And everything went well with the surgery. I did stay in the hospital maybe for about an extra day because of blood pressure issues. But the experience and the care that I had from my nurses as well as my OB physician was excellent. And recovering from surgery there in the hospital, pain was under control, but I was tired, which is interesting, right? You don't realize that, hey, you did just have major surgery. You're going to be tired. And plus, you have a baby that's up all the time for the most part. So definitely consider that. You're not going to necessarily feel the same as you did when you walked into the hospital to have the baby. You're going to probably feel a little bit more tired. And I did. There was actually a couple nights where the nurses were so kind. They gave me a 4-hour reprieve in the middle of the night so I could rest. And they play with the baby, which was great, because it takes a while for you to get that in your head that, oh, I'm a mother now and I just got to and get with it. But it's a gradual type of thing to kind of get acquainted with. So, but overall, my experience was wonderful. Yeah,
I'm so glad to hear that.
yeah.
I was wondering if you could share any advice or insights that you have for other women who may be facing like a similar experience with fibroids or, fertility.
Right. So I would say, first of all, if it's bothersome in any way, which is usually some sort of pain, discomfort, or bleeding, take care of it as best as you can. And this is, whether you think you're going to want to have children or not, that might change in the future. But what do fibroids do? They can grow. The symptoms can get worse. Why sit on it? Why wait? Okay. So as soon as you're aware of it, consider that. Now, not everybody has, because not everybody has symptoms. But if you are even the least bit thinking of becoming pregnant, it's wise for you to seek out care from an OB/GYN physician or specialist just to know what your options are. So at least you have it in your head of what to do at in that time and space. So even if you don't necessarily want to do something right at that moment, that you at least have that information so that you can kind of make an informed decision to maybe tackle it at a later date. But it's easier to do it that way than to have to experience it the way that many unfortunately experience it once they're already pregnant, you know? And don't get me wrong, there's lots of women who have fibroids that have a normal pregnancy, right? It's more so a concern of the size and the location in your symptoms, right? But if you have an idea that it will be an issue potentially for you, take care of it. That's what I would say. Pregnancy already is complicated. Of course, it's a joy of an experience. And, why add to that if you have the means to kind of take care of it? So that's what I would share. A lot of times I think we put off care of ourselves for so many different reasons. And I'm happy that in that instant, even though I was in a resident, running around, that I at least took the time to just stop and take care of myself instead of waiting, because who knows what could have happened. So yeah,
Great
that's the advice
advice.
that I would give.
Yeah, great advice. Thank you for sharing that. Do you feel like your experiences have impacted your perspective on women's health and advocacy in general?
Yeah, it has. Like I said, being a physician and being a patient also, you pick up on certain things, right? Because you're experiencing it now on that other side. So I feel like I have a good understanding. I have a unique experience where, with my patients, I can understand where they're coming from, even though I have that expertise, and I can talk to them about their fear and their concerns in a way that they can understand, because now I've been on that other side, and I feel that I'm able to share information with them, guide them, and it's almost like we have a little bit of a bond, like, hey, I've been there before, and I'm also have some expertise in this area. Okay, I think that goes a long way. So yeah, that's kind of how I would look at it, as far as talking to others about it. And also, like I said before, advocating for yourself, because it's not a guarantee that there's going to be someone out there advocating it for you, because you're the one experiencing it, right? It's impacting you. So I think as patients, as women, just being in that space, you have to learn, or if you're not already doing it, to advocate for yourself and take care of yourself, right? Because that baby is going to be dependent on you, and you want the best outcome that you can have. So do whatever you can to try to make that a reality as much as possible.
Now, looking back, is there anything that you wish you had known or done differently during your journey?
So with regards to fibroids, no. With regards to fertility, yes. Because looking back at our residency program, it was six of us, and three of us were women. And one of my colleagues, female, she had two babies, two babies while she was in residency. And I'm like, wow, I don't think I could have done that, because you don't get that much time off. Gosh, even more reason to put it off. If I could do it again, I probably would have done what she did. And I say that just from my personal experience. It's not to dissuade anyone, just because having a baby when you're older, my goodness, you're already tired, you're dealing with things, the way that it affects the body. Me comparing this to friends that had their children earlier, me looking back like, oh gosh, why would you do that? You have your career, you need to do this and that. You can do both, you know? So me looking back, I probably would have started my family sooner if I could, as far as from a fertility perspective. Yeah. You shouldn't let that get in the way of wanting to have kids if you want to have them at that time. You shouldn't have to push it, put it on the back burner.
I agree. I agree.
Mhm.
Is there anything else that you would love to share with the Birth Squad?
Let's see. Nothing else other than kind of what we just mentioned, advocate for yourself, advocate for yourself, advocate for yourself. A lot of times as patients, we default to letting others make decisions for us, and then we have regret later on. It's okay to ask questions. I tell my patients, it's okay to ask me questions. That's what I'm here for. You don't have to do anything that I tell you to, but I can here to help guide you. Okay. So as patients, always remember that. And if you don't feel that you're getting the right care, no one is answering your questions, you kind of have that gut feeling that, hey, this isn't going in the direction that I want it to, seek help elsewhere. But don't ignore what you're going through, is what I would say. Because a lot of times that's where things go wrong. We take for granted what we're feeling. We assume that someone else knows best. And that's unfortunately where we see, bad outcomes like maternal deaths. Okay. So I think that's kind of one, just to end things, something that I would want to share with your audience.
I think that is such great advice. That gut feeling that you speak of, it's not just about how the
Mhm.
experience, what happened in the experience, but also how you felt about the experience, right?
That's part of the
Yes,
experience, right?
exactly.
Yeah.
So, yeah, so really good
Yeah.
advice for that.
Yeah.
Thank you so much. That was amazing.
Thank you, God. Thank you for having me. Sorry it took so long, but at least my voice is back right now. It took a while.
And it was worth the wait.
Yeah.
Yeah. And thank you for getting on me, not giving up. I'm glad that we got this done.
Yeah.
Yes.
Well, have a great day.
All right.
Thank you. That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors because at the end of the day, you are the experts of your experience. And we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.